CEN Written Exams Test. Question 1. A patient presents with chest pain, shortness of breath, and pleuritic pain. Vital signs: HR 110, RR 24, SpO2 88% on room air. The patient recently had knee surgery. Which diagnosis is most likely? Option A, myocardial infarction. Option B, pulmonary embolism. Option C, pneumothorax. Option D, pericarditis. The correct answer is option B, pulmonary embolism. This patient has risk factors for VTE, recent surgery, immobility, and presents with the classic triad of dyspnea, chest pain, and hypoxia. Pulmonary embolism, PE, should be suspected. Wells criteria and PERC rule can help stratify risk. CTA is the diagnostic test of choice. Anticoagulation should be initiated promptly if PE is confirmed or strongly suspected. Question 2. A patient presents with anxiety, palpitations, and a feeling of impending doom. Vital signs: HR 110, BP 140/90, RR 22. The patient reports a stressful event. The CEN should: Option A, rule out medical causes, ACS, PE, hyperthyroidism, etc. Option B, administer a benzodiazepine. Option C, reassure the patient and send home. Option D, perform a psychiatric evaluation. The correct answer is option A. Rule out medical causes, ACS, PE, hyperthyroidism, etc. Many psychiatric symptoms, panic attacks, anxiety, hyperventilation, can mimic medical emergencies. The CEN must rule out medical causes like ACS, PE, hyperthyroidism, and thyrotoxicosis before treating the patient for anxiety or panic disorder. An ECG, labs, thyroid, glucose, and appropriate imaging should be considered. Once medical causes are ruled out, anxiolytics may be considered. Question 3. A patient with stable supraventricular tachycardia, SVT, is not responding to vagal maneuvers. Which medication should the CEN anticipate? Option A, amiodarone 150 mg 4. Option B, adenosine 6 mg rapid 4 push. Option C, diltiazem 20 mg 4. Option D, metoprolol 5 mg 4. The correct answer is option B, adenosine 6 mg rapid 4 push. Adenosine is the first-line medication for stable SVT. It is given as a rapid 4 push, 1 to 2 seconds, followed by a 20 ml saline flush. The initial dose is 6 mg. If ineffective, a second dose of 12 mg may be given. Adenosine works by transiently blocking AV node conduction. Amiodarone, diltiazem, and metoprolol are also used for rate control in certain tachyarrhythmias but are not first line for SVT. Question 4. A patient with organophosphate poisoning presents with excessive salivation, bronchuria, and muscle fasciculations. The CEN should anticipate: Option A, atropine and pralidoxime, 2-PAM. Option B, naloxone. Option C, flumazenol. Option D, activated charcoal. The correct answer is option A, atropine and pralidoxime, 2-PAM. Organophosphate poisoning, e.g., from pesticides, causes cholinergic crisis, sludge, salivation, lacrimation, urination, diaphoresis, GI distress, emesis. Treatment includes atropine, to block muscarinic effects, and pralidoxime, 2-PAM, to regenerate acetylcholinesterase. Decontamination is also essential: remove clothing, wash skin. Naloxone is for opioid overdose, flumazenol for benzodiazepines. Question 5. Which medication is indicated for status epilepticus as a first-line agent? Option A, lorazepam, Ativan, 4 mg 4. Option B, fosphenytoin 20 mg/kg 4. Option C, levetiracetam, Keppra, 1 gram 4. Option D valproic acid 20 mg/kg 4. The correct answer is option A. Lorazepam, Ativan, 4 mg 4. Benzodiazepines are the first-line treatment for status epilepticus. Lorazepam 4 mg 4, or diazepam 10 mg 4, is the preferred agent. If the seizure continues, second-line agents include fosphenytoin, valproic acid, or levetiracetam. Airway management and ABCs are priorities. Early treatment reduces morbidity and mortality. Question 6. A patient has a left-sided stroke. The CEN should anticipate. Option A. Right-sided weakness and expressive aphasia. Option B. Left-sided weakness and neglect. Option C. Right-sided weakness and impulsivity. Option D. Left-sided weakness and aphasia. The correct answer is option A. Right-sided weakness and expressive aphasia. A left-sided, dominant hemisphere stroke typically results in right-sided hemiparesis and aphasia, expressive or receptive. A right-sided stroke causes left-sided weakness and neglect, ignoring the left side of the body and environment. This knowledge helps prioritize interventions, including swallowing assessment, dysphagia, speech therapy, and fall prevention. Question 7. A patient with a history of opioid use disorder presents with respiratory depression and constricted pupils. Which medication should the CEN anticipate? Option A. Naloxone, Narcan, 0.4 mg 4. Option B. Flumazenil, Romazicon. Option C. Naltrexone. Option D. Buprenorphine. The correct answer is option A. Naloxone, Narcan, 0.4 mg 4. Naloxone is the opioid antagonist used to reverse opioid overdose, which presents with respiratory depression, pinpoint pupils, and decreased consciousness. The dose may be repeated if there is no response. Flumazenil is for benzodiazepine overdose. Naltrexone and buprenorphine are used for maintenance therapy, not reversal. Airway management is the priority. Question 8. Which law requires screening and stabilization of patients in the ED, regardless of ability to pay? Option A. HIPAA. Option B. EMTALA. Option C. OSHA. Option D. ACA. The correct answer is option B. EMTALA. The Emergency Medical Treatment and Labor Act, EMTALA, requires that anyone coming to an ED must be screened and stabilized, regardless of their ability to pay. This applies to all hospitals that participate in Medicare. Patients cannot be transferred without being stabilized, unless medically indicated. EMTALA ensures access to emergency care for all. Question 9. A patient presents with acute onset of severe dyspnea, pleuritic chest pain, and tachycardia. The patient has a history of DVT. The CEN should suspect. Option A. Pulmonary embolism. Option B. COPD exacerbation. Option C. Spontaneous pneumothorax. Option D. Asthma exacerbation. The correct answer is option A. Pulmonary embolism. This presentation with risk factors, DVT history, is classic for pulmonary embolism. PE should be suspected in patients with acute dyspnea, chest pain, hypoxemia, and signs of DVT. Diagnosis is confirmed with CTA. Treatment includes anticoagulation, heparin or direct oral anticoagulants, and possibly thrombolysis for massive PE. Question 10. A patient with a crush injury to the lower extremity presents with pain, swelling, and dark urine, tea-colored. Which complication is the CEN most concerned about? Option A. Compartment syndrome. Option B. rhabdomyolysis. Option C. Fat embolism. Option D. Infection. The correct answer is option B. Rhabdomyolysis. Crush injuries can lead to rhabdomyolysis, characterized by muscle breakdown and release of myoglobin, leading to dark, tea-colored, urine, elevated creatinine kinase, and risk of acute kidney injury. Treatment includes aggressive hydration, normal saline, alkalinization of urine with sodium bicarbonate, and possible dialysis. Compartment syndrome can also occur, but dark urine is a classic sign of rhabdomyolysis. Question 11. A patient presents with a chemical splash to the eye. The CEN should: Option A. Neutralize the chemical with a buffer. Option B. Irrigate the eye continuously until pH is neutral. Option C. Patch the eye and refer to ophthalmology. Option D. Administer antibiotics. The correct answer is option B. Irrigate the eye continuously until pH is neutral. Chemical eye injuries require immediate and continuous irrigation with normal saline or lactated Ringer's solution until the pH of the eye is neutral, pH 7.0. Alkali burns are more damaging than acid burns and require extended irrigation. Irrigation should begin immediately and continue for at least 15 to 30 minutes. For severe alkali burns, it may take hours. Antibiotics and patching may be used after irrigation. Question 12. A patient presents with a fractured ankle, severe pain, and inability to bear weight. Which intervention is appropriate? Option A. Apply a splint and elevate the leg. Option B. Apply a cast and discharge the patient. Option C. Administer 4 antibiotics. Option D. Apply a tourniquet. The correct answer is option A. Apply a splint and elevate the leg. An uncomplicated ankle fracture should be splinted, not casted, to allow for swelling, and the leg should be elevated to reduce swelling. The patient should be evaluated for a fracture and the neurovascular status documented. Casting is not appropriate until swelling has resolved. Antibiotics are not indicated for closed fractures. Question 13. A patient with a severe asthma exacerbation is not responding to continuous bronchodilators and systemic steroids. The CEN should: Option A. Administer magnesium sulfate. Option B. Prepare for intubation. Option C. Administer Heliox. Option D. Administer epinephrine. The correct answer is option B. Prepare for intubation. Refractory severe asthma may progress to respiratory failure. Magnesium sulfate is a second-line treatment that may help, but if the patient is in impending respiratory failure, exhaustion, confusion, silent chest, intubation is needed. Heliox is a rescue therapy for some patients but not first line. Epinephrine may be given for anaphylaxis but not asthma. Question 14. A patient with a corneal abrasion should receive which treatment? Option A. Antibiotic eye drops. Option B. NSAID eye drops. Option C. Cycloplegic agents. Option D. All of the above. The correct answer is option D. All of the above. Corneal abrasion, scratch on the cornea, is treated with topical antibiotics, to prevent infection, NSAIDs, for pain, and cycloplegic agents, to reduce ciliary spasm and pain. A patch may be used for comfort but is not always recommended. A slit lamp examination with fluorescein staining confirms the diagnosis and rules out a foreign body or ulceration. Question 15. A patient presents with a bowel obstruction, nausea, vomiting, abdominal distension, and obstipation. Which imaging study is preferred? Option A. Abdominal X-ray. Option B. CT scan with oral contrast. Option C. Ultrasound. Option D. MRI. The correct answer is option B. CT scan with oral contrast. CT with oral and for contrast is the preferred imaging for suspected bowel obstruction, as it can identify the location, cause, and complications of obstruction. Abdominal X-ray may show air fluid levels but lacks specificity. Ultrasound and MRI are less sensitive. Management includes NPO status, NG tube placement, for fluids, and surgical consultation. Question 16. A patient with increased intracranial pressure, ICP, from a head injury has a Glasgow Coma Scale, GCS, of 8. Which finding is most concerning for elevated ICP? Option A, Cushing's triad, hypertension, bradycardia, irregular respirations. Option B, tachycardia and hypotension. Option C, dilated pupils with brisk response. Option D, restlessness. The correct answer is option A. Cushing's triad, hypertension, bradycardia, irregular respirations. Cushing's triad, hypertension, bradycardia, and irregular respirations, is a classic, late sign of increased ICP, indicating brainstem compression and imminent herniation. This requires emergent intervention, elevating the head of the bed to 30 degrees, hyperventilation, target PaCO2 30 to 35 mmHg, osmotic therapy, mannitol or hypertonic saline, and possibly surgical decompression. Tachycardia and hypotension suggest shock, not elevated ICP. Unilateral pupillary dilation suggests herniation. Question 17. Which triage system is used in mass casualty incidents? Option A, START, simple triage and rapid treatment. Option B, SALT, sort, assess, life-saving interventions, treatment/transport. Option C, Manchester triage system. Option D, both A and B. The correct answer is option D, both A and B. START, simple triage and rapid treatment, and SALT, sort, assess, life-saving interventions, treatment/transport, are the triage systems used in mass casualty incidents. START categorizes patients into 4 categories: red, immediate, yellow, delayed, green, minor, black, deceased/expectant, based on respirations, pulse, and mental status. SALT is a more comprehensive version. Question 18. A patient presents with sudden, severe, and sharp pain in the right lower quadrant, nausea, and vomiting. Rebound tenderness is present. The CEN should suspect. Option A, pancreatitis. Option B, appendicitis. Option C, diverticulitis. Option D, ovarian cyst. The correct answer is option B, appendicitis. Appendicitis typically presents with periumbilical pain that migrates to the right lower quadrant, McBurney's point, anorexia, nausea, vomiting, and fever. Rebound tenderness and guarding suggest peritoneal irritation. CT scan with contrast is the diagnostic test of choice. Surgical consultation is needed promptly to prevent perforation. Question 19. A patient with SVT has failed vagal maneuvers. The CEN should prepare to administer. Option A, adenosine 6 mg 4 push. Option B, atropine 1 mg 4. Option C, epinephrine 1 mg 4. Option D, amiodarone 300 mg 4. The correct answer is option A, adenosine 6 mg 4 push. Adenosine is first line for stable SVT. It is given as a rapid 4 push, 1 to 2 seconds, followed by a 20 ml saline flush. Atropine is for bradycardia. Epinephrine is for cardiac arrest. Amiodarone is for ventricular arrhythmias. Adenosine works by transiently blocking AV node conduction. Question 20. A patient presents with heat stroke, temperature 40.5 degrees Celsius, 105 degrees Fahrenheit, confusion, and hot, dry skin. The priority intervention is Option A, 4 fluids. Option B, cooling measures, ice packs, cold water immersion. Option C, antipyretics, acetaminophen. Option D, neurological assessment. The correct answer is option B, cooling measures, ice packs, cold water immersion. Heat stroke is a life-threatening emergency requiring rapid cooling. The priority is to lower the core temperature as quickly as possible using ice packs, cold water immersion, or evaporative cooling. Antipyretics are ineffective in heat stroke because the pathophysiology is not hypothalamic. Cooling should be done until the core temperature reaches 38.9 degrees Celsius, 102 degrees Fahrenheit. 4 fluids are supportive. Question 21. A patient with a tracheostomy tube dislodges it. The CEN should: Option A, call respiratory therapy. Option B, reinsert the tracheostomy tube immediately. Option C, cover the stoma and ventilate via bag mask over the mouth and nose. Option D, suction the stoma and reinsert a smaller tube. The correct answer is option C. Cover the stoma and ventilate via bag mask over the mouth and nose. If a tracheostomy tube dislodges, the CEN should cover the stoma with a gloved hand and attempt to ventilate via bag mask over the mouth and nose. If ventilation is not effective, the stoma may be used for ventilation, with a smaller tube or tracheostomy obturator. Reinsertion should be attempted by trained staff. Blind attempts can create a false passage. Suction and airway support are priorities. Question 22. A patient with a known abdominal aortic aneurysm, AAA, presents with sudden onset of severe back pain and hypotension. What is the priority action? Option A, obtain a stat abdominal CT. Option B, prepare for emergent surgical repair. Option C, administer 4 fluids to restore blood pressure. Option D, obtain a 12-lead ECG. The correct answer is option B. Prepare for emergent surgical repair. Sudden back pain and hypotension in a patient with a known AAA is a ruptured AAA until proven otherwise. This is a surgical emergency. Immediate surgical consultation is the priority. CT may confirm but should not delay surgical preparation. 4 fluids should be given cautiously, permissive hypotension, to avoid increasing bleeding before surgical control. ECG is not the priority. Question 23. A patient with suspected carbon monoxide poisoning has a headache, nausea, and confusion. The CEN should: Option A, administer high-flow oxygen via a non-rebreather mask. Option B, obtain a CT head. Option C, administer activated charcoal. Option D, obtain a carboxyhemoglobin level. The correct answer is option D. Obtain a carboxyhemoglobin level. CO poisoning presents with headache, nausea, confusion, and cherry red skin, late sign. The diagnosis is confirmed with a carboxyhemoglobin, COHB, level. Treatment includes high-flow oxygen, non-rebreather mask. Hyperbaric oxygen therapy may be indicated for severe cases, COHB 25%, cardiac ischemia, neurologic symptoms, or loss of consciousness. CT is for head trauma, charcoal is not indicated for CO poisoning. Question 24. What is the most common dysrhythmia associated with acute myocardial infarction? Option A, atrial fibrillation. Option B, ventricular tachycardia. Option C, ventricular fibrillation. Option D, premature ventricular contractions, PVCs. The correct answer is option D. Premature ventricular contractions, PVCs. PVCs are the most common dysrhythmia seen in acute MI, often indicating myocardial irritability. While ventricular tachycardia and ventricular fibrillation are more dangerous, PVCs are more frequent. Atrial fibrillation can also occur but is less common. Reperfusion therapy and antiarrhythmic management are key strategies. Question 25. A patient with a psychiatric emergency is being discharged. The CEN should: Option A, provide a written crisis plan and resources. Option B, schedule a follow-up appointment. Option C, ensure the patient has a safe discharge plan. Option D, all of the above. The correct answer is option D, all of the above. Psychiatric discharge planning is an essential part of emergency nursing care. It includes providing a written crisis plan, referral to community resources, scheduling follow-up appointments, and ensuring a safe home environment. This is part of the professional issues domain, covering discharge planning, patient safety, and continuity of care.